So there's a nerve, and keep watching it. Do you see how it's getting flat? It's flatter there. It's kind of like more like a pancake shaped. Here it's rounder, a little bit more oval, and we get down here, and that's probably about where it's about to come to the outside of that tissue. You can barely see it right there. Hi guys, Dr. Anderson here, and I'm here with Kurt from Iowa, and both him and his sister team, and they're here for resolving their restless legs, and he's reporting right now probably about 60% improvement, right?
Correct.
And
yes.
so that's, we've done one leg, and that was his right leg last week, and we're going to be doing his left leg, and I really liked how well this showed up on video, or I should say on the ultrasound. So I want to really show you something we do here is we evaluate these nerve tunnels when you get here in terms of where they're located, and not so much that, but also how much pressure is on the nerves. And the one I'm going to show you on this video is a superficial peroneal nerve. And if you kind of show on the leg here, this lower part of your leg, lower half, lower 1/3, is where there's a nerve branch called the superficial peroneal nerve. And on the ultrasound, I'm going to show you an interesting phenomena that we've noticed now for some time, because the idea is the nerve up higher in the leg is in muscle, and there's a sheath that's covering all the muscles. It's kind of like dense, fibrous, connective tissue. And as the nerve comes down to this level, what it's doing is it's actually going from being underneath the tissue, and now it comes to the outside of the tissue. This is usually something I'll use to demonstrate to my patients. So pretend this is the sheath and this is the nerve. Once it's in this area, it gets towards the outside, and all we're doing, if I had a scissors, we're just simply opening up that sheath that's covering the nerve. But right before it exits and gets on the outside of the sheath, there's so much pressure from that tissue pushing down on the nerve that the nerve actually gets a little deformed. It gets kind of squished or compressed. So I'm going to show you this real quick, and we can usually see this on most all of our patients, but Kurt really demonstrated really well. So if you look really closely, we might want to zoom in. So and I'm up higher in his leg. If you look right there, so that's the nerve. That white line is the sheath, and if I have him move his foot up and down, can you move your foot up and down? All that tissue moving, all that is muscle, but you see how that nerve just kind of stays where it's at. Now just, if you can hold still, I'm going to come down. So there's a nerve, and keep watching it. Do you see how it's getting flat? It's flatter there. It's kind of like more like a pancake shaped. Here it's rounder, a little bit more oval, and we get down here, and that's probably about where it's about to come to the outside of that tissue. You can barely see it right there. So that's it. So this nerve, not these other nerves that we work on. There's usually 3 that we might be looking at opening to get rid of your restless legs. But this specific one has different locations, so we use the ultrasound to better identify how high or how low the nerve tunnel is in the leg, and that helps us. It's not perfect, but it's pretty accurate so that we can make smaller incisions to have access to the nerve. So if this is new to you, understand that we really believe in something we like to call restless leg compression syndrome. We really believe that most people, this is something that is caused by nerve tunnels being tight. It's very mechanical. It's not metabolic necessarily as much as you might think. There may be components of it that is, but I truly believe for many people, the majority of your symptoms are caused from these tunnels being too tight. So please subscribe to our YouTube channel, and thank you, Kurt, for watching or participating in this. I guess you can watch it later. But thanks for coming from Iowa to do this, and hopefully you'll learn something about that if you're watching. And this is just a little bit more evidence that this can work. So the surgery can work, that is. And again, subscribe and consider giving us a like as you watch this. Thank you.